Hi everyone, my name is Sapnika Chatkar. I am a pediatric ICU physician and anesthesiologist, and I recently had COVID-19. I was on service in the pediatric intensive care unit, and about 4 days into my service time, I started to have symptoms and also found out that one of my colleagues on the same team in the intensive care unit all had tested positive for COVID-19. I started out with having some myalgias, and shortly thereafter started to have some cough and low-grade fever. And fortunately at Johns Hopkins, where I work, we were tested very expeditiously, and I received my testing result within 24 hours that I was COVID-19 positive. Shortly after finding out I was positive, I immediately came home and isolated myself in my bedroom for a total of 14 days away from my family. They were in the same house with me, but they delivered my food and drink outside of my room, and I didn't have any contact with them because it was critically important that I did not expose my family to a possible infection. During the week that I was in the intensive care unit, luckily my family did not seem to have been exposed to the disease. I made sure that I wore what I call commute clothes to the hospital, changed before I came home from work, and left my shoes outside, made sure I didn't bring anything in from the hospital into the house, and immediately went to take a shower before I interacted with my family. And as soon as I found out I was exposed, I actually quarantined myself starting at that time. So I'm very blessed that my family wasn't impacted and they continue to be healthy. When I went into isolation, the first 4 to 5 days were really tough. I had a pretty severe cough. Luckily, it did not progress or worsen to more severe disease, so I was one of the lucky ones that had mild disease. I made sure that I stayed very hydrated. I got a lot of rest and just monitored my symptoms very closely. So it started with myalgias, low-grade fevers. It progressed with cough and intense fatigue with intermittent symptoms. And finally, the most surprising symptom was the lack of smell. I had a complete loss of smell by day 4 and 5, which actually did not return until about day 10 to 12 of my illness. I was cough-free by day 10, and eventually the fevers actually ended by day 5. So I was very fortunate from that perspective. Being isolated away from my family, despite having Zoom and FaceTime and online games and all of the different types of human interaction that we have in this day and age with all of our technology, was really, really difficult. It was much more difficult than I expected, and it really gave me just a tiny, tiny glimpse into what our patients experience in the intensive care unit when they're isolated, especially in the COVID pandemic, where we're wearing gowns and PPE and family members aren't allowed to visit. By day 10, it was a really dark place, not to have human touch and not to have that direct human contact. I would watch my family from the window playing outside and interacting with each other, and I realized at that point that I truly am an extrovert. That became very clear. But things I did in isolation to try to stay productive, I did start educating others about my experience with the disease and things that I felt that I did do that may have made a difference in why my family wasn't impacted, including all of the quarantine activities that I talked about, as well as the efforts that I made in order to not bring the infection home from the hospital, which I know is a huge, huge concern for all of my colleagues across the world who are working in this pandemic. What I'm looking forward to now that I have come out of isolation, now I am about a week post my 14-day isolation period. I am headed to the front lines in the adult intensive care unit. Because of my background as an anesthesiologist, I'm very excited to have the opportunity to contribute in that way. And I'm also getting involved in several different research studies. Now that I potentially am an immune survivor, I am planning to donate my convalescent plasma in research studies that can hopefully help other patients, and also donating blood for research so they can learn more about the antibody response to this disease. My message for everyone out there is to make sure that you know that no matter what you're doing, staying at home may seem like you're not making a big impact. But that is the biggest and most important thing you can do. And as medical professionals, it's really important that we share with our family and friends that what they're doing is extraordinarily important to flatten the curve. Hopefully, I'm one of the few people that many of my family and friends will ever know with COVID-19, and the goal is to keep it that way. I realize that I'm very blessed. There are many others that are not so lucky and had severe disease, and it's all of our responsibility to flatten the curve, stay at home, social distance, and thank you to all of my colleagues across the world and everyone who's doing their part to flatten the curve across the world. Thank you so much.